Thank you very much. Good morning, good afternoon, everybody. It's a pleasure to have the opportunity to talk today about an issue of great importance in our community, the value of the partnership between experts and patient advocates. Before addressing the topic, please let me briefly introduce Sarcoma Patients Euronet, the organization I represent as an appointed member of the board of directors. Here, my declaration of interest. Sarcoma Patients Euronet SPAN is the international network of national sarcomologists and desmoid patient advocacy groups. It currently represents 54 groups around the world, 26 countries, 5 continents. At SPAN, we are patients, survivors, caregivers, and patient advocates. We are engineers, chemists, project managers, communication professionals. In a nutshell, we are an interdisciplinary team of experienced, dedicated, and motivated people. Making a difference for all sarcoma patients and their relatives is our mission. Improving treatments and healthcare organization, supporting and driving high quality research, increasing awareness, and providing a strong patient voice at global level are the overarching goals of our vision. To achieve these goals, we need to build strong collaborations with all stakeholders, first and foremost with experts. Different perspectives, different points of view are essential in order to address sarcoma challenges and break down the barriers encountered by patients along their disease pathway. Here are some of the main collaborations in which SPAN was and is currently involved. These include the European projects such as Years Ewing and Eurosarc, networking within and outside Europe, such as Huracan and CellNet, as well as close collaborations with scientific societies within and outside Europe, ESMO, EMSOS, CITOS. In order to better understand the value of these collaborations, it's useful to briefly recall the main difficulties faced by sarcoma patients who report some of the poorest experiences of any cancer type. Lack of professional expertise results in delays and errors. Up to 40% of diagnoses are incorrect. Up to 1 patient in 4 is treated for something else. Difficulty includes limited access to clinical trials, limited therapeutic options, lack of information on disease, and above all on specialized centers, inequalities in accessing available treatments. Although the situation varies from country to country, sarcoma challenges fundamentally relate to these 4 areas: healthcare organization, clinical practice, research, and timely access.
Sorry, Ornella, I unmuted you by incidents. Could you please unmute yourself again? Thanks.
Can you hear me?
Yes, sorry for this, but this happens from
No problem. No problem. Although the situation varies from country to country, sarcoma challenges fundamentally relate to these 4 areas: healthcare organization, clinical practice, research, and timely access to new drugs. Regulatory obstacles and health technology assessment issues can limit the timely patient access for several different reasons. Moving on to the challenges for healthcare systems, they mainly relate to the need for reference centers and dedicated networks, for multidisciplinary teams, for the optimal management of patients, for the adoption and implementation of clinical guidelines. Experience has demonstrated better outcomes, both in terms of overall survival and progression-free survival, when patients are managed in reference centers and within dedicated networks. For this reason, the creation in 2017 of the European reference networks was the best result of the lobbying action carried out by patient advocates and experts together in order to respond to patient needs for highly specialized care in context of rarity. Huracan is the reference network that deals with rare adult cancers, and it includes a specific domain on sarcomas. Networking is crucial not only for high quality care, but also for research that in rare cancers is strictly interrelated too. Patient-centered care and patient empowerment are central concepts of the European legislation on networks, in which patient advocates are fully involved as partners, sitting on the boards and steering committees together with experts. The role of patients is furthermore well underlined in the Rare Cancer Agenda 2030, a booklet produced by the Joint Action on Rare Cancers, which contains 10 recommendations for the European policy agenda for the next decade. The 10th recommendation relates to the full engagement of patients in all crucial areas, ranging from healthcare organization to research, from education to regulatory issues, and the state-of-the-art instruments, first and foremost, clinical guidelines. It's worth mentioning about the latter point, the involvement of SPAN in the production of the ESMO Huracan and CellNet clinical guidelines for soft tissue sarcomas and GIST. Moving on to clinical challenges, they mainly relate to the need for early and accurate diagnosis, correct biopsy procedure, appropriate curative treatment, but also for rehabilitation, still under research, especially among the younger age groups, for advanced metastatic care and palliative care. It goes without saying that clinical challenges relate to the entire patient care pathway. Working together, experts and patient advocates can help to better address clinical challenges and optimize clinical care by pursuing a better understanding of the disease and the impact on patients and its impact on patient lives. Consensus roundtables are valuable tools in bringing together experts and patient advocates to discuss problems, to identify gaps, and to look for solutions for optimizing care and guiding research. Here are some of the past, current, and future roundtables jointly organized by SPINE and experts. The implementation, continuation, and support of such roundtables are becoming an increasing part of a SPINE strategy. Working together, experts and patient advocates can help to better address several other questions, such as those regarding the assessment of outcomes. Let's think, for example, at the use of patient-reported outcomes to capture patient perspective on the disease and treatments received, potentially providing information absent in conventional data. Patient-reported outcomes can be employed both in clinical research as endpoints, providing additional value also from a regulatory perspective and along the entire patient care pathway. The integration of research with clinical practice through the collection of real-world data, especially patient-reported outcomes measures, along the entire patient care pathway, that is to say, putting PROMs on center stage, has the potential to build a stronger evidence-based advocacy and therefore empower evidence-based medicine. That is, by definition, the integration of the best scientific evidence with clinical expertise and patient values to facilitate clinical decision-making. And if we consider that for patients, value can be seen as the acronym of variations in my actual life and usual experience, then choosing appropriate outcome measures is crucial in building evidence. Certainly, many challenges are still to be faced for the full implementation of patient values and perspective in clinical care and research, such as those regarding methodological obstacles, as well as those related to a systematic patient involvement in these processes. But let's take a look at these questions. These are some of the questions raised in a recent reflection paper for the development of guidelines to provide a globally harmonized approach for the inclusion of patient perspectives in a way methodologically sustainable, both for industry drug development and regulatory authorities. Working together, experts and patient advocates can help to better collect real-world data and set up and manage clinical registries that may provide important information about patient management appropriateness in real-world practice helping to overcome the difficulty in building evidence through conventional methodologies. Clinical registries are essential in order to better understand what happens immediately and in the mid to long term, and how patients perform in different age groups. Moving on to research challenges, the fundamental question is how research progress can be accelerated in order to have an impact on patient lives. That is to say, how to ensure the relevance of the research produced on patient lives. The list of research challenges is broad, and it relates to the entire research spectrum. The lack of public funding for basic research, that is the prerequisite of any therapeutic advance. The difficulty of challenging the value of depth of translational research, as it is expensive and risky. The organizational, methodological, regulatory limits affecting clinical research are all critical issues calling for closer partnerships and the new business models. Let's think, for example, at the potential value of patient-driven research, as well as at open innovation business models for drug development. All the more in the current scenario, where the multi-omics integrated approach, together with new technologies such as artificial intelligence, are reshaping the oncology landscape and fostering patient hopes. That is to say, new opportunities, not only for novel drug development, but also for a drug repurposing approach. Focusing on clinical research in sarcomas, obtaining evidence through conventional methodology on clinical trials still remains a very challenging issue because of the scarcity of numbers. To overcome this limit, there are essentially two ways: organizing larger-sized clinical trials for which extensive collaborative networks are required, or working on trials methodologies. In these last few years, many efforts have been made on both of them by the scientific and patient community. As in the case of working on methodologies, the adoption of Bayesian logic, the identification of new surrogate endpoints, the use of adaptive trials are all instrumental in building evidence, refining the conventional approach by taking into consideration the higher degree of uncertainty. In 2014, a consensus paper on the methodology of clinical trials in rare cancers, developed by experts and patient advocates together, was published and discussed with DMA, the European Regulatory Agency, to accelerate patient access to promising new drugs. Another challenging issue in clinical research relates to early patient involvement in the study protocol design, as it is also recommended by the European regulation on clinical trials. Patient involvement in the study design phase has the potential to offer patient-unique perspective and drive a more pragmatic trial design in order to yield study results that more accurately reflect the real-world setting. However, an even more challenging and stimulating issue relates to patient involvement in the research priority setting. That is to say, at the very beginning of the entire research process. Incorporating a patient perspective at this stage has the potential to ensure that the research more fully meets patient needs. On the other hand, the current paradigm of patient-centeredness doesn't make sense unless the right research questions are asked, patient perspective is included, and progress is also evaluated on the basis of what really matters to patients. Years Ewing project is one of the most interesting experiences in which patients and patient advocates have been both engaged and involved in a systematic manner in translational and clinical research, oversighting research activities and setting priorities for next generation research. Introductory training and education in research were offered to patients, and at the same time, close interactions were developed to allow experts to be given patient perspectives on the research being conducted. 3 years ago, a survey for setting the research priority agenda together with patients and carers was launched by Spine in collaboration with several stakeholders in the sarcoma research field. Questions and answers have been organized according to the CSO classification system. The first results, presented at CITOS last month, identify a list of 24 unanswered research questions. And the prioritization of the first 10 top questions is the aim of the next phase of this study. In conclusion, learn from the past, work for the future, keeping in mind that the important thing is to never stop questioning. Thank you very much for your attention.
Thank you very much for this great presentation, Ornella. I think you've touched on many, many points, and we will actually hear from two former patients now, what kind of challenges they have actually experienced. So I'm happy now to introduce you to two amazing young ladies who will answer a couple of questions for us. Mieke Barding and Helena Leuven both have experience being Ewing sarcoma patients themselves. Both have been diagnosed at the very young age of 17 with localized Ewing sarcoma, and both underwent both surgery and chemotherapy, and for Mieke also radiotherapy. So Helena, you're now a medical doctor, so you kind of changed sides, working at the AYA station at the University Hospital of Essen, Germany. And I was wondering, how does your experience of having been a Ewing patient, how does that influence your work with the patients?
Yeah, so hi everybody, first of all, thank you for having me. Yes, how it influences my work, I thought about it, and I think I often remember how I was treated when I was a patient 12 years ago, and I try to use some of my positive experiences in my daily patient care. But in addition, now looking from a physician's perspective, I have to admit that I often underestimated the implication of side effects and its potential complications. And so I did not understand why it's so important to comply with the doctor's orders and when I was a patient. So now I try to learn from that and educate my patients about things like that, because I think we will get better compliance with better education.
That's a wonderful message. Thank you. So the biggest challenge for you being a doctor and having the experience of being a patient yourself, what's the biggest challenge for you?
The biggest challenge for me is, I think, finding the fine balance between an empathic and therapeutic relationship, while using my experience as a former patient, like I just said, and at the same time keeping a professional boundary in order to protect myself, because every patient with Ewing sarcoma still has got his or her own individual journey, and sometimes I have to stop myself comparing my own story to one of my patients. So I think that's my biggest challenge at the moment.
And do you have a message you would like to give to doctors or to patients with you having the experience from both sides?
Yes, I have. I would like to say to the doctors, first, be honest and realistic when you talk to your patients, and take the time, even if you're busy, to educate them. I'm sure you will get more compliance and maybe less complications. Secondly, I want to add to what Jasmine said yesterday, because I think it's very important. Take your patients seriously. They often have the right gut feeling, and usually they know their body better than we know. And to the patients, I want to say, trust yourself. Tell your doctors about your gut feeling, your fears or your concerns. Only when they get that information, they can take it and maybe incorporate that in your care plan, and listen to your doctor when they say, go to the hospital when you get a fever. And to all of us, to doctors, patients, and scientists, I want to say that we have to promote awareness to further research of Ewing sarcoma and cancer in general, to ultimately increase the chance of survival because of the research of many years and many motivated and fantastic doctors and scientists like you, Mike and I and some other patients are here today. And most patients of Ewing sarcoma with Ewing sarcoma are very young, and maybe some other of them dream of becoming doctors themselves.
Thank you, Helena. That was a very, very strong message. And I think you are and will be a great asset to both the expert and the patient community. Thank you very much.
Thank you.
Mike. Mike used to be very sporty when she received her diagnosis. She fenced, she rided, she vaulted, and then she got diagnosed with Ewing sarcoma in the hip, and that was quite a disruption of her life and what was important to her. But she has been back on the horse only 1 month after surgery and is back to her full capabilities today. So Mike, would you like to tell us how you did that and what helped you achieve it, and which role did your doctors play in that?
Yeah. First of all, good morning. To be honest, I didn't really thought about how I could do it. I just wanted to live my life as the same way I did before. I did a lot of sports. I love to meet my friends. I didn't want that this tumor determined my life. First of all, the doctor smiled at my immigrations when I explained them that I want to do my A-levels and that I won't stop doing my sports. They said I could try it, but it's totally okay to stop these things. But after a while, they support me and my plans. They help me to live my life as the same way as much as possible than I did it before. They allowed me to write my exams in the hospital, and one example of their support was when I was at the hospital with fever because of an abscess at my head. But I have to go home soon because I had my A-levels Viva Vogue. They helped me with a lot of units of stored blood to improve my bad blood values for my exam. So because of this support, I could complete my A-levels Viva Vogue 2 days after I getting my operation at my head. So all in all, I could say that the doctors support me, but especially they smiled at all my, I would say, acts that I made during the therapy. And I would say that they are maybe a little bit proud of me and my acts and their results I did during and after my therapy.
And you have every reason to be proud yourself to doing A-levels with that kind of history. Mike, you're also active on Instagram, and you posted a video earlier this year with a very strong message. Would you maybe like to tell us about it?
Yes, I posted a video on my Instagram profile in February. This year has two proposals. One proposal was to collect money for the Ewing sarcoma. And the other proposal was to make sure that the people who see this video understand another message about the people who fight against cancer. A part of this message is about that I just want to point out to the non-affected people to treat the affected people equally. It's not that mean that cancer patients are teased, but rather that you are treated like a raw egg. Of course, in some ways you can't do many things while you are getting your therapy. the way you used to, but you just want the normality back in your life. Yes, but when everyone always wants to help you with everything, and when they look at you with pity, when you're not doing so well, or when people look at you strangely at the street because you're just wearing a headscarf, then this is anything but normal. So all in all, I just want to say that it's not the bald head or the gray skin or the sick face that people who have cancer stand for either. I think it's the big fighter heart and the iron will to the pride that such people should stand for.
Wow, I applaud you to that. Is there any kind of message you would like to send out to doctors treating Ewing sarcoma patients or to Ewing sarcoma patients in addition to what you just said?
Yeah. When I think about it, I would say that the doctors who treat Ewing sarcoma patients should motivate them to catch things during their therapy. It doesn't matter how big or how small those things are, but when you get successes during your therapy, it will give you a hope, and this hope is going to motivate you to keep fighting. And another point is that I hope that doctors support their patients as the same way like I got support. I'm very happy that the doctors who helps me did such wonderful things to me, and they supported me in every situation. And to the Ewing sarcoma patients, I could say that you must have to fight. Diagnosis of cancer is not urgent a death sentence. Of course, it's a shock, but you don't have to ask why. And in the fact, no one earns such a diagnosis. And that's the fact. No one earns such a diagnosis. Sorry, and you have to say to yourself, even when I got it, I will fight it, and it doesn't get me under, because medicine could be as good as possible. If your own fighter spirit isn't awake, you only hardly go to make it, or you don't. And in the end, your own little fighter inside you decide whether you stay down or whether you get up and keep fighting. And I myself always used to say I don't have cancer, but I only have a malignant tumor that had to be treated with therapy. And I don't let the tumor ruin my life. Yeah.
Thank you very, very much, both of you. We're a little over time, but I think if anyone has any questions, I think we can take one or two. Anyone? No. Okay, then
maybe I ask a question to Mieke, also referring to the last session of our meeting today. Did sports in the hospital help you?
Yeah, I would say yes, because that sport forced me to not lying in bed all day, because it was a good thing at the day. I always was very happy that when the sports people, I say, come in and say, Mieke, we're doing something, because often I have a lot of bad feelings, or I was a little bit angry about anything, and with this sport they helped me to calm down a little bit.
So any other questions? No. Okay.
I don't have a question. I just wanted to make a comment, and I said this yesterday in the scientific session already. I think it's great, really great for us physician scientists to have you both here, Helena and Mieke. And this is, I think, one of the most important achievements that we had in in the field in the last decade, the empowerment and the participation of you as patients. And we are very grateful for that.
It is hard to add something to that. I actually more or less wanted to say the same, that the first part of working together is probably listening to each other, and then that is what we are doing here today and yesterday. And I'm very grateful for having the opportunity to have this cooperative and collaborative meeting today. And I would also like all of you to invite you to work with us together at SPAN and the German Sarcoma Foundation on well, moving things forward for a better situation for sarcoma patients and their relatives and their families. So thank you very much for this session. And I think we have a 5-minute break before we start our first scientific session.
Okay, run to grab some coffee.